Continue.
Thank you, Mr President. I move the motion standing in my name that this Council 1 acknowledges that the 14th of September 2023 is Are You OK Day. 2, recognises the important work and advocacy Are You OK Day does in the mental health space. 3, encourages people to ask others, are you OK, supporting mental health and awareness in our community. And 4, notes the contribution Are You OK Day has made to the attitude and discussion of mental health since its inaugural event in 2009. Mr President, an unknown number of Australians attempt suicide every year, but there is an estimate that suggests that figures exceed 65,000 Australians per year. There is 8.6 Australians who commit suicide per day. That's more than double the road toll. Suicide is the leading cause of death for those aged between 15 and 44, and we know that people in rural and regional populations are 2 times more likely to take their life. The suicide rate in Aboriginal and Torres Strait Islander communities is twice that of their non-Indigenous counterparts, and 75% of those who take their own life are male. Is everyone listening? Because these are startling figures. These are figures that I had to do a double take on when I first read them. They are figures that I hope shock and concern everybody in this place. I'm sure that every single person that's in this chamber right now would be aware of someone that is close to them who has had their own mental health battles and challenges, and perhaps there may even be some people in this chamber who have had their own battles along the way. Too often, I think we get preoccupied and busy with our day-to-day lives and the hustle and bustle that sometimes we might miss people that might need that little bit of extra support. When we ask if someone's okay, are we really listening to them? Do we really dig that little bit deeper when perhaps they say, I'm good? How often do we really say, are you sure? And do you want to have a chat? How often do we get caught up in the busyness of life that we neglect our own well-being? How often do we let pride perhaps get in the way when we do need to ask for that little bit of support if we are struggling? Tomorrow marks Are You OK Day, so I hope this serves as a reminder as we reflect on these tragically high statistics, that this can serve as a prompt, a reminder to check in with a loved one, to check in with your family, your friends, your colleagues, but also, really importantly, to check in with yourself. Go for that walk or that run. Take care of your well-being. Perhaps make that appointment with the psychologist that you've been dreading. To make that first step in getting help and acknowledging that perhaps you might not be okay. And you know what? That's okay too. An estimated 1 in 3 Australians reported feeling lonely. Are You OK Day is a public health promotion charity that encourages people to stay connected and have conversations that can help others through difficult times in their lives. Are You OK contributes to suicide prevention efforts by encouraging people to invest more time in their personal relationships and building the capacity of informal support networks, friends, family, colleagues, to be alert to those around them, have conversations if they identify signs of distress or difficulty, and connect someone to the appropriate support before they're in crisis. Mr President, we know that when someone takes their life, it has a ripple effect. Lifeline has shown that beyond the tragic loss of the person, the impact of suicide deaths are felt by up to 135 people. Let that sink in. 135 people. Their family, the friends, the colleagues, the first responders at the time of death are all impacted by each death. So today I move this motion to keep the conversation going. I move this motion in the hope to continue to break down the stigma that is often associated with talking about mental health and to acknowledging that people aren't always okay. Because after all, Mr President, it's okay to not be okay.